Doctors of Reddit, what do patients do that annoy you? According to my nurse girlfriend, when they bring their family member who has some medical training, and that family member orders me around, come to me and ask me what they could potentially have, and then interrupt me because their Google PhD knows better. When they come up with these miraculous ways to lose weight fast or ways to keep looking young. When they come in with non-evidence based, unproven and sometimes dangerous recommendations from their naturopath's egg. Broccoli juice cures cancer. Med student, but usually something along the lines of, are you smoker? Nope. Have you ever smoked? Yes. How long were you smoking for? -2 packs a day for 50 years. When did you give up? 3 days ago. When patients tell me I've got a really high pain threshold during the history and then act like they are being axe murdered when I take blood or put in fourth line. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot, I try to help them out as much as I can, but it's another when they say things like I just don't believe in medicine, or I think I can fix this with coconut oil / turmeric / essential oil / crystals, and I don't trust any of your advice. I feel like I've done nothing to help their little friend, and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20 and the medicine they've declined is cheaper than that. I've even gotten no's when I try to give them a free trim so that I could send home meds. Not a doctor, but when I'm doing history intake, when the patient says it should be in the chart for basic screening questions like, do you have a family history of cancer? Non-compliant. So you're not feeling any better after the antibiotics? I didn't take them. It is not their fault, but where I came from we have to see 40.60 patients in an afternoon. Time is of the essence and we have nearly 15 minutes to interview, figure out what they have, and tell them what can be done. Because of the time frame, during the interview we need objective answers, something patients avoid like hell. We ask when the pain started and they say, well, I was at Mary's wedding when it started. Thinking, who's Mary? When was it? 28th day. Thinking, of which month? I have several other patients and don't want to be rude with this one, but I need answers. Try to stab me in the heart with a silver rod. Also feed me garlic and hold 2 pieces of wood together trying to make a cross. The eternal paradox of demanding all of the physician's time for themselves while expecting him to tend to others quickly. Did you waste 15 minutes of your consult shuffling papers or going on about unrelated stuff? Take a look at the next person going in as you walk out of the consultory. That's also his/her time you were wasting. Physical therapist here. When this conversation happens, patient, you made my back pain worse. Me, oh no. Which home exercise aggravates your pain? Patient, I didn't do them. Me, okay, then what did make your back pain worse? Patient, I have no idea. Me, what did you do yesterday? Patient, well, I felt better after you examined me, so I played golf for 6 hours yesterday / went to roller derby practice / helped 3 friends move / ran a half marathon with no training, and now I feel worse. Me, facepalm. What's really frustrating in this thread is that I understand why some of those things would annoy doctors, but it's also turning people away. The best would be to have, like in the UK, a helpline to explain what's going on that would help you decide what to do. That way you don't uselessly clog services while still talking to a professional. Belittling their GPS/family doctors. I'm not a GP, but they don't just deal with colds and gastro. If the GP misses your DVT, you could die. If the GP misses your bowel cancer, you could die. If the GP doesn't treat you for a community-acquired pneumonia, you could die. If the GP doesn't realize that your headache is actually meningitis, you could die or be left with brain damage. And what is there to belittle? GPs in Australia can make at least $35 for 2 minutes of work. That's all it takes to sort out a sick note or a flu shot. This should be asked of our nurses. They weed out many patients' annoyances before the doctors ever see the patients. When the question asks a specific group, example, doctor/engineer, and you get a million not a doctor engineer people chiming in. I'm a doc. The worst is the patient that is allergic to everything except the medicine that they want, which is diluted most of the time. Biomedical engineering, very sick individual here. For me, not wear their goddamn braces. For doctors I've spoken to, not take their goddamn pills. Honestly, showing up late to an appointment, I feel obligated to see them, and then my other patients end up waiting. Even if it's just 5 minutes, it adds up over patients, and it's tough to cut a visit short when you only have 20 minutes allotted in the first place. A patient can come to me with the most bizarre or trite complaint, and it won't bother me because I'm there to help them out. But I hate keeping my patients waiting as much as they hate having to wait. According to Dr. House, lie. I'm a dentist, and we know most patients are pretty high anxiety, and everybody deals with that in their own ways. Sometimes it's talking a lot, sometimes it's wincing even though nothing hurts, sometimes it's even being mean to me or my staff. We get it, and that is why we spend time before any procedures explaining things and talking about anything you want. But what really annoys me is once we get going, I just need you to sit still and keep your mouth wide open. I'm performing microsurgery on your tooth with a very sharp drill that spins at 300,000 RPM, and I need to make cuts to tolerances of 1/10 of a millimeter in dark confined spaces in the back of your mouth. I'm sorry you don't like the feeling of your own saliva pooling in your mouth, but I just need you to suck it up for 30 seconds, so I can do a good job and we won't have to redo this in 6 months. Not a doctor for the sake this post, but pharmacist chiming in. Patient, I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice? Me, well, there's no evidence to suggest that this product is effective, but this Claritin/Zyrtec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy type symptoms including runny nose, and is labeled for use in a child this young. Patient, no thanks, I'll just give this other crap after wasting 10 minutes of your valuable time against your professional advice. When they eat goddamn apples. The biggest thing for me is not being able to provide a useful medical history. Even if you don't know anything about medicine, you should know whether or not you have diabetes/high blood pressure/lupus. Same for medications. Just write down a list and bring it with you. It's amazing how many people can't tell you how long they've had X symptoms, if they've ever had them before, etc. And no, I can't skip the questions and just look in the computer, because the electronic records are often incomplete or out of date. I know we ask a ton of questions, but I promise they're important, and it's really hard to help you if you can't answer any of them. I feel so much better about staying home for anything less than 8/10 pain or an infection that lasts longer than a week. Doctors, am I doing the right thing by staying home with gastro as well? My abdominal pain is a 11/10, said the patient calmly while sitting comfortably, drinking Starbucks, and playing Candy Crush on their iPhone. My mother is a doctor. She told that about once a month, patients try to sell things to my mother's office. They can be anything: insurance, secrets of Asia pills, etc. Some guys even preach in her office. I stopped taking my medication 3 months ago because my bingo buddy said it doesn't work. No, I didn't tell you because I thought you'd be upset. I want what's best for you. If you're not okay with the treatment, we can talk about it. Also, when said friend comes in and says they only use their daily mess once a week because it didn't work, gee, I wonder why it wasn't life-changing. New patient, I need refills on my medications. Me, I haven't prescribed you anything before. What were you taking? New patient, Vicodin and Xanax. Patients who don't use their screening opportunities. I'm in the UK, so it's all free, but so many people don't get their cervical smears, or bowel cancer screening, mammograms, routine ST and HIV checks, not just when you think you might have caught one. It's such a small part of your time, and has the potential to save your life. coming with a complaint, and giving really vague answers to all questions. For example, me, when did it start? Patient, oh it's been a while now. Me, how long is a while? A day, a week, a month. Coming in with extremely complicated / tight clothing. Please assume that, if you are coming in for any complaint, that you are going to have to take off your trousers, shoes, and socks. Please don't wear any high lace-up boots. Wear slip-ons. Although each of these things only takes 30 seconds extra, if each patient has a few of these macro delays, that means that at the end of the day I will be running an hour late. This helps nobody. When they don't set their phones to silent mode or even pick up or read a text message when I'm talking to them, it's disrespectful and tends to me taking them less serious. If your phone is more important than your health is right now, you probably don't feel that bad. This happens all the time. Doctor, do you have any pre-existing condition? Old lady, no, I'm very healthy. Doctor, do you take any medication? Old lady, oh yes, I take this for my blood pressure, this for my blood sugar, this for me heart, this for my thyroid, etc. Patients call in to ask for a refill. I look at the record, and it looks like they've had refills a few weeks ago, so I ask which medicine. They don't know. Typical responses include the doctor knows, all of them, the white one. When I ask a question and they don't want to answer, I'm not here to get some gossip on you. I honestly don't care on a personal level. If you do eat dog food, put stuff up your butt, or like the smell of glue, but all that stuff that sounds either invasive or irrelevant to you can potentially be medically relevant. Case in point, something as out there as whether or not you eat grapefruit is medically important in certain situations. If you take certain drugs, it can negate the effect. My mother has worked as a biller for a doctor's office, gastroenterologist, for years. Some of the ones she comes home complaining about include, but not limited to, people telling her about their symptoms. She's not a doctor. Please save this for him. Calling to complain about how much an office visit costs. Yes, even if it is $20. She does not control this. There is not anything she can do about it. Bringing in stool samples to show her. Yes, it really happens. My aunt, pediatrician, hates patients who have zero medical knowledge. A mother came in with her son one day. He has these funny bumps going up his back. Are they dangerous? Fascipums, and points to the woman the spine on a skeleton. I tell my employees not to bring me these. I say, if you say you're sick, you're sick. If I didn't trust you, you wouldn't be working here. What good does it do anyway? Even if someone isn't sick, they can go to the doctor, say they are, and get a note. I've done a dork knob comment on a psychotic episode. That was lovely. He was doing a history, and I wasn't running the conversation for once, which I'm bad for, and about 6 months before present he said we were done. I had my first psychotic episode last week. Not a doctor, and not a patient per se, but I had a woman call 911 once for a body who was supposedly murdered underneath a railroad bridge during a massive music festival. When we got there, it ended being a log with a jacket thrown over it, and a very drunk woman sobbing over said log. I worked for a company that you would not get your monthly bonus if you had a sick day without a doctor's note. I always felt stupid for getting them, but it was the only way I would get paid. The dork knob comment isn't really the patient's fault, I feel. I'm learning medical assisting / nursing stuff, and one of the things we went over is how you really have to listen to the patient, because 15 minutes isn't usually a lot of time to get all of the info in, and for some reason they might not even think to say important things until then end, or they might say them as an aside. I know that I've done it myself. I've had a lot of things I'd wanted to ask about and literally remembered at the last minute the thing that was probably the most important thing to get checked. I was the person with the dork knob comment once. I literally went to the doctor for what I thought might be strep, and then, at the end, I mentioned a lump I'd found in my boob. I was only 34, so I didn't take it seriously, but still, I was right there, in the office. So why not? I almost didn't even mention it. So I was only 34 when I was diagnosed with cancer. It's been more than a decade since then, but I'm so very glad the doc took the time to come back and check it out and then have the staff set me up with a mammogram. Yes to the first. A million times yes. It drives me insane. I work in radiation oncology, so patients who see me have cancer anyway, and I've generally seen their bits in the initial consult. On their treatment reviews, they talk for 10 minutes about their job, then just as they leave they mention the real thing. Once, a patient told me on his way out that he coughed up a part of his tumor. No joke. And another who had shoved a tampon up his ass to stop the bleeding. We are used to seeing all of your bits, we don't care. Just tell us, so we can do something. My workplace and most workplaces I know of in Australia require a medical certificate for any sick absence of 2 days or more, and allow a maximum of 5 uncertified sick days in a year, which means having to go to the doctor when you have a runny nose. It's a massive waste of resources, particularly in a nation with a public healthcare system. It's a huge waste of tax dollars, and I always feel bad going into the doctor with a runny nose just to ask for a certificate. But the doctors shouldn't be annoyed at the patients. We don't want to be there either. They should be annoyed at the workplaces that have these requirements. Edit. Got my Schultz and shouldn't mixed up. I hated getting doctor's notes, but if it saved you from getting in trouble from being sick, unfortunately in the bottom feeders of jobs, aka retail, we must do what we must to keep our pathetic jobs, so we can pay for our welfare life. The whole note thing is required where I work, only because we need written confirmation that we have no restrictions and can work at 100%. Unfortunately, that could mean for just one day, where we are feeling under the weather to broken bones or near death. I feel like both of those seem to be unreasonable things to be annoyed at a patient for. Like others have said, talking about ailments can be really difficult for some people and the patient can't really help it if their employer requires a certificate. My previous boss wanted a note from my surgeon to explain that I was gone from work to have surgery. So not only do you not care that I'm having surgery, but you also want to waste a medical professional's time to write you a stupid note. Not like surgeons are doing anything important, yeah no. I quit a few weeks later